Yeah, right where your bra strap. Go ahead and lay down and just experiment that. Does that seem like a lot of height, or do you want to bring it down one notch?
Yeah, that seems all right.
Yeah. Okay,
Well,
good.
show us what exactly we're doing, and we'll let you know.
Yeah.
What exactly
That's what you're doing. Just what you see. Yeah.
That's cool. All right. No popping or rolling or anything. Nothing crazy.
Maybe.
See. Okay.
Maybe. But I don't think so.
Okay.
I did some popping and rolling yesterday, but how is that? Okay, now take the roll and move it to the side. We're not using it right now. You just want to have it set up and ready to go. So our bolsters and our thoracic roll. Is temperature okay?
Yes.
Good. It feels good, doesn't it?
Nice.
It does. Thank you. It's getting long, isn't it?
I like the color too. It's very nice.
All right, so we're doing a little bit of taping today, but nobody else is on. My name is Joanne, for those of you who are joining me today. Namaste. We're going to begin our practice flat on our backs, no props in the way, and we'll do a body scan. It's been a long time since we've done a body scan. And this is a technique that John Kabat-Zinn uses when he first starts working with his heart patients. He's a medical doctor in the Harvard-Yale system up north, and he has helped heart patients who have gone through surgery to restore themselves to a lifestyle where they're not at risk of another heart attack. Okay. Because what do you think is causing these heart attacks? Stress, right? Stress that happens in our minds, and stress that happens from our foods and our environment and so on. So just lay on your back and bring your feet out. Bring your legs out into a little bit of an angle. Bring your arms a little further away from the side of your body so they're nice and relaxed. And then wiggle your body a little bit so that you've leveled yourself out, okay, to the best of your ability. And in this practice, in this meditation, the body scan, we are looking to identify the places in our body where we have our torques. And we have them. We have a little scoliosis going on. We have frozen shoulders. We have dropped legs, which is the different leg lengths, right? Or we have a raised hip, either way. But you get the drill. You know these. You know you have these nooks and crannies in your body. We just want to see where they are. Drop into your meditation. Relax the muscles of your forehead and let your eyeballs rest gently in the socket. And to the best of your ability, separate your teeth in your mouth. Really relax your jawbone. Unpark your tongue from the roof of your mouth. To the best of your ability, do that. And relax all the muscles in the crown chakra. Breathe so that there's space between the flesh and the skull. Bring your breath purposefully up into your forehead and the crown of your head, using the energy of your breath to relax this whole theater. Let the muscles of your face just melt. We're moving our personality out of the way. The muscles of our face actually hold our personality in place. So we're letting that all go. Relax your muscles, relax your thoughts. And relax all of the muscles in your neck so that you can open up your throat chakra, the channel of communication, and you can receive messages from your body. Relax the front of your neck, the sides of your neck, and the back. So the whole chakra center of your throat is free and can rotate freely. Good. Now bring your attention to the place where your head is touching the earth. And notice if the right side or the left side is making contact with the earth sooner. Is the left side or the right side of your head level? Or does it appear that one side is touching the ground more than the other side? Develop an awareness to notice how your skull is actually making contact with the earth. This is usually a first indicator of how our neck may be torqued. And make a mental note, left side, right side, or perfectly even. So at the end of the class, when we do our body scan, you will be able to notice if your yin and restorative yoga practice has made a difference in your body alignment. Bring your attention to your shoulders. Right shoulder, left shoulder. And the whole theater between the shoulders. The low neck, upper thoracic, that whole area. Bring your attention there. And notice how your neck and shoulders are making contact with the earth. Is one shoulder more pressure on the ground and one shoulder is maybe lifted? Are they even? Do you have one shoulder reaching for the ear and the other one is dropping? Make a mental picture of where your shoulders are now. And remember that for your body scan at the end of the class. And bring your attention now to your shoulder blades, where your angel wings are. Bring your attention to how your shoulder blades are making contact with the earth. Notice here if there's any tension, any tightness. Which side, left or right? Take a mental snapshot and now bring your attention down to the middle of your torso. So this will be thoracic 7, the whole waist area. And just see how your mid-torso is making contact with the earth. This is where my torque is. This is where my scoliosis is, in the thoracic spine. So I'm usually torqued in here, just giving you a point of reference. Take a mental snapshot and now move down to your low back. And are your hips resting evenly on the earth? Is the pelvic shelf stable and even? Or are you sensing that one side is lifted or one side is dropped? Very good. And now, for a moment, check back in with your face with your forehead and with your crown chakra and see if any tension has developed there that comes from thinking, and go ahead and relax again. Reset, relax, move your thinking out of the way so that you're able to listen to your body intelligence. Your body is speaking to you. Now bring your attention to your buttocks and the tops of your thighs, the back of your thighs. And notice if there is an even pressure of both the left and the right, or are you noticing that one side is heavier than the other? Is one side making contact with the earth before the other? A lift or a drop or a torque? Make a mental snapshot of that body awareness and move down to your thighs, the space between your knees and your hips. And notice how your legs are making contact with your mat. And now your calves. Move your attention down the leg between the knees and the ankles. And notice, is one leg heavier than the other? Do you have one knee turning out? Do you have a knee turning in? Just be aware. Maybe your yoga practice can start to change the alignment of your bones, your ligaments, your tendons, the fascia. And that would be the point of this practice. And now bring your attention to your ankles. How are your ankles turned out, in? Do you have one foot up and another turned out? This is a good indication of a torque. It just means that we're compensating somewhere else in our body for that particular alignment. And now your heels. The final place is how your heels are resting. Is one heavier than the other? Sometimes our heels are sore. Do you have a sore heel? And now from the bottoms of your feet to the top of your head, scan your body one step at a time, just like we did on the way down, at your own pace, making a mental note of where you notice there might be some misalignment, some stressing, some pressure.